Welcome back, everybody. We have Linda back with us this week. We have Dr. M as usual. And of course, ever present, almost ever present, we have Dr. P. And I'm sure he's got some things, words of wisdom to share with us today. Again, welcome to Vedere. I'm Dr. Navtej Desange, and we are talking about save a toe this week. Save a toe. Linda, why are we talking about save a toe? What do we mean by save a toe? What are we talking about?
Well, we're talking about not cutting pieces off of people, not losing our digits, not losing our feet, which leads to greater risk of mortality, morbidity and mortality. It's not to make light of it, but it's like the tip of the iceberg, so to speak, the tip of the foot.
Yes, Linda, I suppose I asked the question in a flippant way, in my medically uneducated flippant way, because I've never heard that toes could be so easily lost. Is it a big problem? I suppose that's why I'm asking, why are we talking about it? How big is the problem? How many people lose toes?
Yeah, well, a lifetime. I mean, you're built from the ground up. You walk on your feet. We only have 2 of them. We're not lucky. We don't have 4. We only have 2 of them because we're upright beings. And if you think about what the punishment your feet take in your entire life, A, they're the furthest thing from your heart, so can be circulatory issues. B, they're carrying all your weight, depending upon what that weight is. If you're a 500-pound person, it's not good. And the structure is so, if you were to look at the structure of that part of your body, there are so many interwoven, interlocked, tiny little things that can go wrong, and they take a tremendous amount of punishment throughout our lives. They are affected by circulation. I already mentioned that. They're affected by neurological issues, and with all of the diseases that our elderly population deals with, diabetes, hyperlipidemia, hypertension, vascular.
Hold on. This is so much information, Linda. This is so much information. Explain the link between, let's just say, diabetes and losing a toe. Just explain that link to us, if you would.
I think the easiest way to explain that is that diabetes affects both things, the circulation and the neurological issues in the feet. If you can't feel what's going on in your feet, you don't know if you've stepped on a tack. You don't know if you have an open wound. You don't know if you've got steel wool embedded in the bottom of your feet. You don't know until it may be too late. And that's when you start having pieces of your body removed because there's no way to save them. So diabetes is probably one of the biggest problems that we have to avoid to save our feet.
I'm becoming a little bit more coming a little bit more to grips with this. But Dr. P, could you talk about a little bit more in detail about circulatory and neurological issues that Linda just talked about? Could you put some meat on the bones for that?
Yes. So remember, the reason it's so important is the incidence of diabetes in our population, morbid obesity, vascular disease from smoking, and the loss of our ability to exercise. We are not the characters in 300, the physically fit, and we are actually quite the opposite. And if you see, we have become very sedentary creatures, and we don't pay attention to our feet. We spend a lot of money on our looks and on our clothes, on our entertainment, but we ignore our feet. My patients are walking bare feet outside when they have diabetes. They can't feel anything. They're cutting their own nails when they cannot feel anything and causing ulcers. They're taking jackknives that they cut boxes with to cut off their calluses. I'm not even making it up. We have pedicurists. I think that's the word. They supposed to just do the pedicure. They're cutting off the calluses and causing ulcers. And remember, it's just a small. It takes a micro ulcer, just a small break in the skin. And if
Yeah.
you have diabetes, if your blood flow is reduced, if your nerves are not healthy, if your lymphatics are not draining, that bacterium goes right into the tissue, goes into the flesh, goes to the bone, and you can easily lose a toe. If you lose a toe, you're at a higher risk of losing the foot. If you lose the foot, you're at a higher risk of losing the limb. If you lose the limb, you're at a higher risk of mortality, of losing the whole body. So that is the risk that we run, and a lot of this is preventable. Of course, as we know, much of diabetes is preventable. 90% of diabetes is diabetes type 2, probably even more, which we can impact by nutrition, by exercise, by all the new things that we are learning in healthcare. And then foot care is one of the most important things. It is in the literature, and we need to start paying attention. We need to start educating our patients, our smokers, our patients with back injuries, all these good shoes, good footwear. We have forgotten how to take good care of our feet. I'm going to stop now so that you can, take it from here.
Well, I, as usual, in 6 or 7 minutes, I'm already very educated by what you and Linda have said. I'm already thinking, I'm already pressing on my feet thinking, can I feel my feet and my toes? Thank God I can. So that's great news for all of us. I think that I can feel my feet and toes.
Navtej, we have patients, we've found toothpicks inside their feet. We have found nails inside their feet. They don't even know. And you dig in and you find these and pus coming out. I mean, I don't want to gross you out, but I think it's worthwhile grossing everyone out. So we start paying attention to our feet. So I'm sorry, I'll give it back to you.
Well, I'm glad you're grossing us out because it's the truth.
Yes.
But I'm not particularly glad I'm being grossed out because I feel a bit of pain and pins and needles in my. Dr. M, I've got to move on to you. I've got to get away from Dr. P just for a few minutes now. So give me some good news. What can I make sure? How can our viewers make sure that they save their toes and therefore they save their feet, their knees, their health, everything? Talk us through what we can do to save our toes.
Okay, first of all, you have to know you have feet and you have toes, and if you can't see beyond your gut and you can't see those toes and feet, that's a problem. So weight management is probably one of the biggest issues. People trying to control their weight, bring down their weight, which has gone out of control for a majority of people in this country. So we've got to be paying attention to that. We have to pay attention to the type of footwear we put on our feet. So
what do you mean by that? Tell me what you mean. Tell me what you mean by that.
Footwear. That means shoes. The shoes, yeah. The socks, anything that covers the feet. What I
mean, Dr. M, is what is good footwear and socks and what is bad footwear and socks. That's what I mean.
Well, socks are there to kind of keep to soak up moisture or to warm your feet when your feet are sweating. Say you have an athlete or you're exercising, you're generally going to have a sneaker on with some type of a sock, and that kind of brings it takes up moisture and protects the foot again from anything else, but from the shoe or anything that might hit the foot. There's some degree of protection, but socks are not mandatory for people. I mean, it has its own protection. Some of the socks are compressive. They actually have an effect to help move some of the fluid from the foot that's not moving in people who have a lot of weight or have poor circulation. They cannot bring fluid back. So there's compressive effect of socks. But you don't need socks in general if your feet are very active, and if you wear open, it's more of an open type of shoe. So you can have plus minus sock wear. A person who's a diabetic, they have to have good footwear. They need a shoe that's supportive,
Okay.
preferably closed. If it is open, it needs to have protective, sides and back and so forth. And the base does not should not be flimsy. So you've got to be careful.
Dr. M, does that mean I should not be walking barefoot indoors?
Well, indoors, for the average person who's not suffering with a sugar problem, diabetes, or some vascular disease, that person can walk barefoot indoors. If your indoors are hardwood floors, it may or may not be a good idea. Some people have poor arches, or just, their foot is deformed, there's foot deformities. So you got to be careful with walking on flat surfaces. I mean, your surface may be dirt. If a person who lives in a home that has dirt floor, that may or may not be a good idea. Again, if you have a condition that would be, as Linda said, can be conducive to your injury, or you can't feel your feet, it would be not a good idea to have your foot unprotected by some type of footwear. And, so walking barefoot can be healthful. And I do advocate what's called earthing, which is basically walking barefoot on pure soil, on good soil and or sand. But again, if you are with a condition that might be conducive to you having injury by any little piece and particle, you have to be really careful with that type. Now, you can do earthing with something that is protective on the foot, which can conform to the foot, and it's more flexible, and that may be, that's fine. But healthy people should earth and feel the energies coming up, the frequencies coming up from the earth, which is very charging and stimulating to the body. If a person has a clean soil right underneath them and they are diabetic, absolutely, you can be there. You can stand in clean soil, which has no little pointies, no little sharp pieces, and so on, that would penetrate the skin. And that's very healthy for them, because you get that nice earthly charge, which helps stimulate and activate the body its own way.
Wow. This is, I started this topic thinking we're talking about toes. And now I'm thinking this one episode is not going to be enough time. We need to talk more. Linda, could you give us some, more sort of ways to save a toe? What are the exercises that we can do to save our toes?
Well, any movement is better than none. So, and you should probably discuss with your doctor anything that you've got going on structurally in your body before you take on any kind of exercise. But walking is the simplest, as long as you've got the right thing on your feet, whether it's shoes and socks or whatever. Walking is something that is very, very simple. Everybody can do it. Everybody should be doing it. And it also, for many reasons, use of the muscles. Those people who have the problem with the valves in their veins, the walking, the muscles contracting and letting go assist the blood flow out of the lower extremity back into the circulatory system, because the muscles themselves help that flow go back up. They assist those valves, those faulty valves. Stretching. Always warm up and stretch before you do anything, so that you don't hurt the muscles. If you hurt the muscles, then you're in trouble before you even take that first step. So you really should start out with some nice gentle stretching and warm up, and then do your walking, whether you do it on a treadmill or you go around the block or you're doing it in a gym, whatever. That's probably the simplest thing that you can do as far as exercise is concerned. And then there's so many others. I mean, I work with a trainer who just tortures me every which way he figures he can get to. And really, it's your whole body. I mean, you lose what you don't use. Old adage, but it's absolutely true. And the day you stop moving is the day you can hang it up.
Thank you, Linda. And you're also now making me very, very worried. And I'm busy doing feet and ankle exercises as I'm sitting here talking to you guys. Dr. P, I need to come back to you because you were grossing me out and all our audience. And we need to take a break from that. But I need you to come back to this now. I need you to come back and tell the truth, like you always do, like everybody does. So go ahead. You've got something to add.
Let me gross you out more. Let me gross you out. This is what I tell my patients. Master in grossing people out. So Dr. Scanziano's favorite comedian, Sebastian Maniscalco, comments on about patients' feet, and he has 2 words for advice. Sock it. And he's right. People wearing the same shoes in this moisture and this heat, all the sweat goes inside, gets absorbed in the lining of the shoes. Fungus grows, and then fungus, when you wear it again, fungus comes on your skin.
In the shoe. The fungus grows in the shoe.
Inside the shoe. It's leather, it's food. We are in Florida, it's moisture, it's heat. Okay, and the sweat, beautiful culture medium for bacteria and fungus. So then they put their feet in, and they're going to walk all day in the heat outside, and the moisture comes out, and then the fungus loves to grow on the skin. Now they brought the fungus. So I ask my patients, how often do they wash their underwear? Do they wash it once every 6 months, once every 5 years, or every day? Okay, so they say every day. Of course, they're annoyed with me. So why would you not?
We're all annoyed with you.
Why would you not do that to your feet? Your shoes you're going to wear for 2, 3, 4, 5 years. Some of them are fit to be retired. Some of them are ready to go to the museum and Museum of Podiatric Services or Marvels, and they are still wearing them after 10 years. They are dying, but so look. Just like we change our undergarments every day, hopefully, we should change our socks. We should be putting air out the skin, protect the skin, the moisture, so that your shoes are nice and dry and your socks are able to absorb the moisture and air the skin out. We need to start looking at the feet. You're more focused on looking at your face. You look at it 20 times in the mirror. Look at it. Look between the toes. Look at the nails. Look at the soles.
Hold on. I want to stop you there. Tell me what we need to look between the toes, and then tell me about the nails.
I'll come to that.
Okay.
Integrity of the skin.
Okay.
Integrity of blood flow. And patients may not know this, but they know. Everyone knows good basic care of the body, or should know by now, how to take care of your body. And feet are a part of your body. Start looking at them. In fact, a lot of your diseases can be cured if you take good care of your feet. In fact, the whole system of reflexology is based on affecting your meridians that pass through your feet. I mean, there's a whole science behind it. We ignore our feet because they're too lowly, they're beneath us, pun intended, they're far away. But because of this important role they play, they take everything, take a lot of beating. They're architectural marvels. Our feet are designed beautifully. If you look at how the bones, you know that there are more bones in your hand and your feet than in the rest of your body.
I didn't know that. No, I didn't know that.
So These bones are beautifully arranged, the foot is not a simple flat piece, right? Like a shoe. It has two-way curvature. One curvature like this, one curvature like this. It's a spring. It is able to take the weight and still make you walk. If you look at how it moves as we walk, how it responds, it is a work of science and art. We need to respect it. We need to start looking at it. And one more thing, quickly. We started an initiative to...
More questions for you before I go back to Linda. So tell me the one more thing, and then I've got two more questions.
Yeah, my biggest contribution to my patients' health is to make them aware of their feet. I make them all take off their shoes and socks every time they come, and they're annoyed with me. They're annoyed. I said, you come here, you just want me to listen to your heart, listen to your lungs, touch your belly, and we are done. No, we've just begun. These are the things where you miss. And I tell you, 20 to 30% have a break in their lining of the skin. The integrity of the skin.
You mean between the toes?
Between the toes, on the shins, on the dorsum of the foot, on the soles of the foot. So we started Save a Toe, Save a Soul Pinnacle Initiative. Because if we are educating our patients, if we are educating our providers, if we can save one toe a month, it is well worth it, because you are saving the life of a patient potentially. Okay, let me stop there. Stop grossing you out, and I'll come back.
No. I've got two more questions for you, and then I go to Linda for something else.
Yes.
So you talked about nails, but you didn't tell me what to look for with nails. And then I want you to tell me about ankle strength. So nails and ankle strength. Talk to me about that.
Okay, let's come to the nails. Nails tell you about the health of your body. A good practitioner in the ancient systems, all that they looked at your fingers, they looked at your eyes, they looked at your tongue. It was done. And pulse. The ancient arts of healing, they looked at 3-4 things, diagnosis is made. They didn't even talk to the patient. Not that I recommend it. So nails reflect the health, the stages that you are going through. So do the nails of your toes, the toenails. And we are so worried about how they look. We paint them, we char them, we scar them. I don't even know what all things that are done on them. Start taking care of the nails as an important indicator of what is happening inside. And if we start doing that, the nails should be should look pink. Blood should be flowing. There are ways of testing how the blood is flowing. They should not be full of fungus growing on the nails, which comes from not taking care of your feet. They should not be cut in a bad way. They should not be sinking in your skin. They should not be cut in a way that you cut off your skin. People do that. I had a patient pull out his nail right sitting in front of me in the office. Talk about grossing you out. Oh, this nail is not it. Okay, no problem. He takes the nail off.
Okay. I think I'm done with nails. I'm done with nails now. Okay, quickly tell me about ankle strength. Then I need to talk to Linda about something else. Ankle strength. How do you deal with ankle strength?
We should look at the strength of the whole body, not just the upper body, but the lower body. The feet, the strength of the feet is critically important. The calves, the thighs, the gluteals. The gluteals, as you know, are the most important muscles of your body. And I'm not talking about it aesthetically. To prevent falls in our population, the most important muscle is your buttock. Work on those, strengthen them. Similarly, ankles for balance, preventing falls. And I think we've talked about falls in a previous conversation. Very important. And then arch support. You need shoes that support your arches. We are walking on hard floors all day. We are not walking in sand, soft earth, where your feet are protected. You're walking on hard floors. And so we need good arch support, good shoes, not cheap, because no one pays attention to these shoes. They get the cheapest things and slip them on. But we need to go back and start paying attention to this part of our body. I'll stop.
Dr. P, thank you so much for speaking the truth. Sometimes we call it grossing us out, but speaking the truth, we really do appreciate it. Linda, I'm presuming, okay, that we do the same thing to our feet, whether we are a baby, whether we're a teenager, whether we're 40, 50, 80 or 90. Surely we're going to do the same things to our feet, right? We don't need anything different.
Well,
Or do we?
we do, because teaching our children, I mean, I remember, so I'm 72 now, my children are middle-aged. But I remember worrying about what kind of shoes should I be putting on? When do I put shoes on their feet? What kinds of shoes should they be? So on and so forth. We don't teach our children the importance of their feet at a very early age. So the things that we're attempting to teach the elderly now, on myself included, the horse is out of the barn already and running around. We already have damage. So the earlier we can instill this knowledge in our children, and get them through the teenage years and the young adult years, and every decade has its own challenges when it comes to health and education of our patients and our own families. But if we start, the whole thing is, if we start early enough and we get their attention enough and we teach them to look between the toes and we keep the weight, within normal parameters, and we watch their diets or have them watch their own, we have to teach them how to do this. Nobody's born knowing all of this stuff. So our roles as parents, our roles as clinicians when we see these patients in the office, as a pediatrician, we have to teach the young mother what to be dealing with their children. And as we get older and we're dealing with different things, because no matter how careful we are, genetics gets in the way, accidents happen. I myself have broken my right leg several times because I was bad. I was very active. Let's just say it this way. I was active. So whether I was falling off a horse or falling out of a tree, or playing basketball, something was happening. But that's life. That's living life, and stuff happens. But by knowing my body, knowing the things that could happen, knowing preventative measures at a younger age, you get to be a certain age, and hopefully now you're learning different things, like when to see the podiatrist, like how to take care of your nails. As you get older, things get difficult. Looking at the soles of your feet, I'm going to ask you personally, how easy would that be for you? Or would you have to put a mirror on the ground and put your foot over it to see the bottom of it? I don't know. Can you wrap your leg around the back of your neck? I mean, can you see the bottom of your?
So actually, Linda, you started out by saying that, or implying, or I certainly took it that way, that we do the same things with our feet at every age. But now you're sort of saying, no, the risks at different ages are different, and therefore our focus should be different. Is that right?
Well, it's a scale. Did you have to start someplace? And if you start with the very young and you make them understand that those things at the end of their legs are not there to keep them from fraying, then maybe they'll pay enough attention to them to not go and have a pedicure at one of these places, or to at least know when to see a podiatrist, know when to let the doctor know that something's going wrong, know what to do, what the danger signs are, and what important things they can do, like not wearing 4-inch heels, so that you develop bunions and everything else and screw up your whole leg by walking on high heels your whole life with itty bitty narrow toes. There are so many things that we can learn at different stages so that when we get older, we're not dealing with all of this. And it's not just your feet. It's your nutrition. It's your exercise. It's how you take care of your entire body.
Thank you, Linda. I'm gonna come back to Dr. M now. It's the same sort of question. I want to get more context around key risks and age groups. Dr. M, just roughly, what should we be looking at different ages? What are the key things that people need to be looking at in terms of their feet at different ages? I'm getting a sort of sense that there are different risks at different ages, and I just want to really hone in on that and understand that.
Okay, how far back in age do you want me to go?
Well, I think we covered the early years with Linda, so I think I want to look at I want to go middle age and elderly. You know, give us the landscape, the topology, the feet understanding topology of middle age and old age.
Well, if you were a child that was running around wearing your mommy's high heel shoes, that was the start of a lot of trouble. Let's put it that way. Little girls, even little boys, they like the feel of those crazy shoes. So early on, we're exposed to this, and it basically gets moved right into teenage and adult years. So bad shoes, I'm going to call them what they are. Bad shoes are shoes that have been constructed mainly for fashion's sake, for the way it makes a woman's leg looks. And I'm going to speak the woman right now for a moment, because that's usually where the bad shoes come in. Men generally wearing low heels, something that will not strain their feet, distort their feet, unless they're wearing tight shoes. And tight shoes are another problem. So if your foot is not in a secure base, if you don't have the housing of the foot as something that is secure, comfortable, you can breathe in, that has room. If you don't have that, it's like you're choking off something that is absolutely one of your most important parts. Your foot needs to be loved at an early age. You should learn how to select shoes well, and a good a good teaching for a child would be wearing healthy shoes, like I just said, not high heels, not poorly constructed, very flat shoes which do not support the foot, things that are very tight. People who go into their early 20s and 30s, they will be wearing all of the above, and they will wear very cheap type of shoes. If it's inexpensive and it looks fancy, that's what they're going to be wearing. But as Linda in particular would know, the feeling of a high heel after a few minutes it's pretty awful. And some women are wearing something upwards in the neighborhood of 6 inches, bringing their heels up 6 inches high, leaving the forefoot or the front of the foot way down close to the floor. And that type of posturing of the foot is so damaging, where it shortens muscles. It contracts the muscles of the legs. And so women who have been wearing that type of shoe for a while find it very difficult to put their feet flat on the ground. So it's pathetic. It is really, and it's sad, because then they just put those things back on because it hurts to bring the foot down. You're actually pulling at a contracted muscle that has been tightened and shortened with that high heel. So the woman's shoe, the poorly constructed, the fashionable shoe is one of the worst. It leads to all these foot deformities. Women will have bunions and hammer toes and all of these other distortions, neuromas, where they're in so much pain. Their feet are just falling apart. And then if you have a diabetes on top of that, I mean, you're talking a nightmare. So, so the foot, learning what the foot needs early on in life is really, really important. And if, you know, if the parent is wearing a high heel, the mother's wearing a high heel, the daughter's watching this, you know, it's like, oh, okay, I guess that's the way I'm supposed to be, and I like the way it looks, and so on. But a family that is more conscious will have their feet in comfortable shoes, well-made shoes. They might cost a little more. They could be fashionable, but we have to understand actual kinetics of the foot. We have to know how it operates, how it functions for us, how it holds the body, the effect it's going to have long term if it's not taken care of. So by, you know, someone in their 20s, 30s, 40s, we go up to the middle age, they're going to be having a lot of foot issues if the shoes have been poor all along. If somebody learns as soon as possible in their 30s, perhaps 40s, they can help themselves a lot. But if they don't learn by then and they just keep going, and they're literally, you know, they're going to end up either on some type of a crutch, a cane, a walker, or something, because the feet really are your stability. And if they're not stable.
Who knew the foot was so important? I mean,
so you're going to have to know this. These are very basic things that have to be carried through life. You're carrying yourself with these feet. If they are not well supported, and you're doing very nasty things to them with mindless, you know, let's buy these funky looking shoes, whatever. They look funky, they're colorful, this, that. But if they have no support, I mean, you can get away with that as a 5-year-old. But if you keep doing it up until your teen years and you keep going from there, you know, it does not bode well.
Dr. M, I am really understanding, and I think everybody who's listening to this is really beginning to understand. We're sort of running out of time now, so I know Linda's got her hand raised. Linda, is it 20 seconds? Because that's all you've got before I go back to Dr. P for the final summary.
Think so. I can do this real quick.
Yeah, do it.
So you had asked the question by age group. So your key risks 0 to 10 years are structural. You're growing. Your key risks 10 to 20 years, sports injuries, fungal infections. 20 to 30 is high activity or neglect. You're either doing too much or you're not doing enough. 30 to 40 is weight gain, footwear strain. 40 to 50, early vascular changes, nerve sensitivity. 50 to 60 years, slower healing, mild neuropathy. 60 to 70 years, now you got peripheral arterial disease, neuropathy onset. 70 to 80, you got balance decline, all risks. And 80 to 90 years, now you've got limited mobility and frailty. And there is a whole list of prevention and self-care things you do, but I'm out of time.
You know what? I think we're going to put what you've just said, because you were obviously reading it from some sort of chart. We're going to put this on our YouTube page so everyone has access to it after the show. Brilliant. Thank you for the intervention, Linda. Thank you so much. Dr. P, give us a summary. You've got a few minutes left before the show ends. Give us a summary and your key takeaway for all our viewers.
So very simple. If you save a toe, you save a soul. Please appreciate the pun. The ancient Chinese used to tie the feet of their most well-to-do, well-off women. And if you look at, Ripley's Believe It or Not, the feet were not more than 3 or 4 inches, and they were condemned to live according to the stereotypes set by the society forever. These feet would be fractured. You look at the bones and they're fractured, they're destroyed. And that's how they lived. I don't even know how they balanced themselves and with the, all the falls, multiple fall risk. If I were a physician at that time, I would be having a lot of clinical initiatives going at that time. Now, flat feet are common. And I know this personally.
Okay.
I was born with flat feet. It's common. Then we have to teach the children, they have to get special shoes. In the old days, they used to put them in these casts made of bone, and the children, it hurts them a lot. But you can develop flat feet if you do not take care of your feet, and if you do not take weight, exercise, good footwear. Good footwear is critical. And you gotta free your mindset. Instead of trying to impress others, instead of trying to live for others, this is one place where if you are not healthy, if you're not taking care of yourself, your body, if you have not been educated in seeing, appreciating, respecting the whole body, every part of your body is important. It is there. It forms a complete unit. Each part is critical. One needs to have a very healthy respect, please appreciate the pun, for one's body. And this is to bring your consciousness to an often forgotten part of your anatomy. And we need to start paying attention to it, especially if we have conditions that predispose us towards losing these parts. And you would be surprised when people come with prostheses in, one below the knee amputation, above the knee amputation. You start with one toe, and within a year, you're almost up to the thigh. The leg is gone. The quality is
finish, Dr. P. Let's finish on I always ask you to speak the truth, all of you, and you always do. Let's finish on a positive note for all the people that you've seen who've lost a toe and more. What percentage could have saved the toe?
I would say 80 to 90% could have saved their toes. I mean, most of these patients,
everybody could save their toe.
Yes, unless it's it's totally a disaster that you could not prevent. I understand that. Most of these you can prevent by taking good care of your body and your feet.
The news is good if you take care of your feet. As usual, I am massively educated, and now I'm going to, at the end of the show, I'm going to go and take off my shoes and socks and go and look at my feet and toes. Thank you, Dr. P. Thank you, Dr. M. Thank you, Nurse Linda. And we will see all of you next week for another edition of Happy Health Hour.